What if I told you that something sitting in your medicine cabinet right now, something you may have taken safely for years, could be quietly affecting your memory? Not because it's a bad medication, not because your doctor made a mistake, but because of something almost nobody explains clearly: how certain medications interact with an aging brain. In the next 30 minutes, I'm going to walk you through 9 categories of commonly used medications that research has linked to memory and thinking changes in older adults. Some of these might surprise you. One of them is sitting in almost every household in America, and most people have no idea it's even on this list. I want to be upfront about something important right away. This video is not here to scare you into stopping anything. It's here to help you ask better questions at your next doctor's visit. Stay with me, because number 4 on this list is one I bring up with nearly every patient I see. Hello, I'm Dr. Alex Mandell, and welcome back to the channel. If this is your first time here, this is a place where we talk honestly about the health changes that come with aging. No scare tactics, no confusing medical jargon, just clear, supportive information explained the way I'd explain it to a family member. Today's topic is one I care about deeply because it sits at the intersection of 2 things families worry about most: memory and medication safety. Every week, I see patients and hear from their adult children who are trying to figure out whether a parent's forgetfulness is just aging, a medication side effect, or something more serious. Today, I want to help you tell the difference. To be completely clear from the start, none of the medications I'm about to discuss are dangerous when used appropriately under a doctor's care. Many of them are genuinely important for treating real health conditions. What I want to give you today is awareness so you can have an informed conversation with your doctor, not so you make any changes on your own. Before we dive in, if you find this helpful, please take a moment to like this video and subscribe. It helps this information reach more seniors and families who need it, and it costs you nothing. Now let's get started. Here's something most people have never heard of, and once I explain it, this entire video is going to make a lot more sense. It's called anticholinergic burden. Stay with me, it's simpler than it sounds, and it's the thread that connects several medications on today's list. Your brain relies on a chemical messenger called acetylcholine for things like memory, focus, and clear thinking. A number of common medications, often ones prescribed for completely unrelated reasons like allergies, bladder control, or sleep, work by blocking this chemical at least partially somewhere else in the body. When you take just one of these occasionally, the effect on your brain is usually minor, but when several of these medications are combined or taken consistently over months and years, the effect can add up. Doctors call this cumulative effect anticholinergic burden, and it's one of the most well-documented, evidence-based concerns in senior medication safety today. I remember speaking with a 74-year-old patient named Carol, who came in with her son because she'd been increasingly forgetful over about 6 months, missing appointments, repeating questions, struggling to follow conversations at family dinners. Her son was terrified it was the beginning of dementia. When we reviewed her medication list together, she was taking 4 different medications, each with a mild anticholinergic effect on its own. Individually, none of them looked concerning. Added together, they told a very different story. This is one of the trickiest parts of senior medication safety, and honestly, one of the reasons I wanted to make this video. No single doctor may see the full picture. A cardiologist prescribes a medication for blood pressure, an allergist prescribes something for seasonal symptoms, a urologist prescribes something for bladder control, each decision reasonable on its own, made by a different specialist at a different visit, often months apart. It's frequently a pharmacist doing a full medication reconciliation, or a sharp-eyed family member who's the one who actually sees all the pieces together at once. What happened next surprised her family more than anything. I'll come back to Carol's story shortly because her outcome is exactly why I wanted to make this video. But first, let's go through the 9 categories one at a time. Quick reminder as we get into the list: if this is useful information, take a second to like and subscribe. It genuinely helps more families find this channel. Number 1 on this list is probably sitting in your bathroom cabinet right now, and it's not even a prescription. Older antihistamines, the kind found in many allergy pills and nighttime sleep aids containing an ingredient called diphenhydramine, are strongly anticholinergic. This is one of the most researched categories on today's list. A well-known study published in JAMA Internal Medicine followed thousands of older adults and found that cumulative long-term use of strong anticholinergic medications, including this type of antihistamine, was associated with a higher risk of cognitive decline. The tricky part is that these are sold over the counter. So many seniors take them regularly for allergies or occasional sleeplessness without ever discussing it with their doctor, simply because it doesn't feel like real medication. One of my patients, a 70-year-old man named Frank, had been taking a nighttime allergy pill every single evening for years, not for allergies anymore, but because he'd gotten into the habit of using it to help him sleep. His daughter noticed he seemed foggier in the mornings and was having more trouble finding words during their phone calls. Once we discussed safer alternatives for both his allergies and his sleep, his daughter told me within a few weeks he sounded like his old self on their calls again. If I can buy it without a prescription, it's automatically safe to take every day. Fact. Over-the-counter status reflects safety for short-term, occasional use, not necessarily for daily, long-term use in older adults. Always mention regular OTC use to your doctor or pharmacist. Number 2 is a category many seniors rely on for a very real and understandably sensitive issue. Overactive bladder. Medications like oxybutynin work by relaxing the bladder muscle, but they do this through the same anticholinergic pathway we just discussed, and this particular class tends to have one of the stronger effects on this list. If you're taking a bladder control medication and have noticed new confusion, memory lapses, or difficulty concentrating that started around the same time, this is worth mentioning to your doctor. There are often alternative medications and non-drug approaches for bladder control that carry a lower cognitive risk in older adults. I want to emphasize something here. Bladder control problems are real. They affect quality of life and independence enormously. And I would never want someone to simply stop treatment out of fear after watching this video. This is precisely the kind of situation where a conversation with your doctor about alternative options makes the most sense. If you or someone you love takes a daily bladder medication, this might be worth bringing up at the next appointment. And if this video is helping, a like and subscribe goes a long way in helping more people see it. This next one surprises a lot of families because it's a medication that's often been prescribed for decades, quietly, without much reevaluation. Tricyclic antidepressants, an older class of antidepressant medications, sometimes also prescribed for nerve pain or migraines, are another strongly anticholinergic category. Newer antidepressants developed over the past few decades generally carry a much lower risk of this particular side effect, which is why many doctors now consider switching older patients to newer options when appropriate. She thought it was normal aging, but a patient of mine, Eleanor, 76 years old, had been on the same antidepressant for over 15 years. Her memory changes were so gradual that neither she nor her family noticed a specific starting point. It simply felt like part of getting older. When her pharmacist flagged the medication during a routine review, we worked with her prescribing doctor to slowly transition her to a newer alternative. Her daughter later told me it felt like getting pieces of her mom back. This is a good moment for an important open loop. Transitioning between antidepressants is not something anyone should do on their own. Stopping these medications abruptly can cause serious withdrawal effects and can be dangerous. I'll cover exactly how this should be approached safely later in this video. This is the one I mentioned at the very beginning, the medication I bring up with nearly every patient I see because it's one of the most well documented on this entire list. Benzodiazepines are a class of medications commonly prescribed for anxiety, sleep problems, or muscle tension. Medications like diazepam, lorazepam, and alprazolam fall into this category. Multiple large studies have found an association between long-term benzodiazepine use and increased risk of cognitive decline in older adults, along with a well-established increased risk of falls and confusion, especially at higher doses. The American Geriatric Society specifically flags this class of medication in what's known as the Beers criteria, a widely used guideline that helps doctors identify medications that may need extra caution or reconsideration in older adults. One of my patients, a 78-year-old woman named Patricia, had been taking a low-dose benzodiazepine for anxiety for close to a decade. Her son noticed she'd started having occasional confusion in the evenings and had 2 falls within a few months, something completely out of character for her. Working closely with her doctor, she began a slow, carefully supervised taper over several months. Her balance improved noticeably, and so did her clarity in the evenings. Benzodiazepines should never be stopped suddenly on your own. Abrupt discontinuation can cause serious withdrawal symptoms, including seizures in some cases. Any change to this medication must be done gradually and under a doctor's supervision. This is exactly the kind of information worth sharing with a family member who might be affected. If you haven't yet, please like and subscribe. It helps this reach the people who need to see it. Number 5 is a newer category of sleep medication that many people assume is safer simply because it's not a traditional benzodiazepine. Medications like zolpidem, often known by a common brand name, work differently in the brain but can still cause next-day grogginess, confusion, and memory effects in older adults, along with an increased risk of falls. Myth: newer sleep medications don't carry the same risks as older ones. Fact: while these medications work through a different mechanism, research still links them to next-day cognitive impairment and fall risk in seniors, and the Beers criteria recommends caution with this category as well. His children noticed something was changing with one of my patients, an 80-year-old man who had started using this type of sleep aid nightly after his wife passed away. His confusion was most noticeable in the mornings, and it took his children pointing it out during a visit for him to even consider that his sleep medication might be involved. Once he worked with his doctor on a combination of non-drug sleep strategies and a gradual medication adjustment, both his sleep quality and his morning clarity improved. Most seniors completely miss this point about pain medication, and it's one of the most important on this entire list. Opioid pain medications prescribed after surgery for chronic pain or for serious injuries are well documented to cause confusion, drowsiness, and memory difficulties, particularly in older adults who metabolize these medications more slowly than younger patients. This effect is usually most noticeable shortly after starting the medication or after a dose increase. I remember speaking with a 72-year-old patient who underwent hip surgery and was prescribed an opioid pain medication for recovery. Within days, his family noticed uncharacteristic confusion and disorientation, which frightened everyone involved. Once his medical team adjusted his dosing schedule and incorporated non-opioid pain strategies alongside it, his clarity returned within about a week, well before the medication was even fully discontinued. The important takeaway here is that opioid-related confusion in seniors is often temporary and dose-related, which is a very different situation from a permanent cognitive change, but it absolutely deserves attention and should always be reported to the prescribing doctor. If someone in your family has had a similar experience after surgery, this is worth remembering for next time. And if you're finding value in this video, please take a moment to like and subscribe. Number 7 is a category often prescribed after a back injury or muscle strain. Muscle relaxant medications like cyclobenzaprine. These medications tend to be quite sedating and also carry anticholinergic-like effects, which is why the Beers criteria generally recommends avoiding them in older adults when possible, favoring alternatives such as physical therapy, topical treatments, or other pain management approaches instead. This category is usually prescribed for short-term use already, which helps limit the risk, but it's still worth a conversation with your doctor if you find yourself using one regularly or for an extended period. This next one is going to sound different from everything else so far, and I want to be extra careful and honest with you about it because the science here is genuinely mixed. Proton pump inhibitors, commonly used for long-term acid reflux and known by names many people recognize, have been the subject of some observational studies suggesting a possible association with cognitive decline in older adults. However, I want to be very direct. The evidence here is far less consistent than with the medications we've already discussed. Several large, well-designed studies have found no clear connection, and major medical organizations have not changed their overall recommendations for these medications based on this research. Myth: this medication is proven to cause dementia. Fact: current research shows a possible statistical association in some studies, not a proven cause and effect relationship. This is a great example of why it's important to distinguish between linked to and causes when you see health headlines. I include this one not to alarm you, but because it's a good teaching moment. If you've been on this type of medication long-term for reflux, it's reasonable to periodically check in with your doctor about whether you still need the same dose or whether a step-down approach makes sense, which is good medical practice regardless of the memory question. We're almost through the full list. If this kind of balanced, honest medical breakdown is what you're looking for, subscribing helps you catch every new video as soon as it's released. The final medication on today's list is corticosteroids, such as prednisone, when used at high doses over long periods, often for conditions like severe arthritis, autoimmune disease, or certain lung conditions. Long-term, high-dose steroid use has documented effects on mood, sleep, and memory, and in some cases can contribute to noticeable cognitive changes. I had a patient in her 70s managing a chronic inflammatory condition with long-term steroid treatment. Over about a year, her family noticed increasing irritability alongside memory lapses, which they'd initially attributed entirely to stress. Working with her specialist, her steroid dose was carefully adjusted to the lowest effective level, which is standard long-term management practice for this medication class, and her family noticed a meaningful improvement in both her mood and her memory over the following months. As with several medications on this list, this is not a reason to stop a steroid on your own. Doing so abruptly can be medically dangerous. It's simply another example of why an ongoing, honest conversation with your prescribing doctor matters so much. Now, here's the part of this video I think matters more than any single medication on the list, because I don't want you walking away from this feeling afraid. I want you walking away feeling informed. The most important thing to understand is this: medication-related memory changes are very often partially or fully reversible once the medication is adjusted, reduced, or switched under medical supervision. This is fundamentally different from progressive conditions like Alzheimer's disease, where the underlying changes in the brain are not reversible in the same way. This is exactly why this distinction matters so much for families. If a parent or loved one is showing new memory changes, one of the most valuable early steps alongside seeing a doctor for proper evaluation is a complete medication review. This doesn't replace a medical evaluation for dementia when it's genuinely needed, but it's often overlooked as a starting point. Warning sign: sudden severe confusion that comes on within hours or a day or two should always be treated as a medical emergency and evaluated immediately, since this can sometimes indicate an infection, medication interaction, or another urgent medical issue rather than a gradual cognitive change. Let's go back to Carol, the patient I mentioned earlier. Once we reviewed her 4 medications together, her doctor and pharmacist worked as a team to safely reduce her overall anticholinergic burden, adjusting one medication, switching another to a lower risk alternative, and discontinuing one that was no longer necessary. Over the following 2 months, her son told me the change was remarkable. She was following conversations at dinner again, remembering her grandchildren's school events without reminders, and had genuinely gotten a piece of herself back, in his words. Let's talk about what you can actually do with this information. First, request a full medication review. Many pharmacies offer this service, and it's also something your primary care doctor can do. Bring every medication you take, including over-the-counter products, vitamins, and supplements. Anticholinergic burden adds up across all of these, not just prescriptions. Second, ask specifically about anticholinergic burden and the Beers criteria. These are real, established clinical tools your doctor or pharmacist can use to evaluate your medication list, and simply asking the question by name often prompts a more thorough review. Third, track changes and timing. If you or a family member notices new memory or confusion symptoms, write down when they started and whether they line up with a new medication or dose change. This kind of specific information helps your doctor connect the dots far faster than a general complaint of feeling foggy. Fourth, never stop a medication abruptly on your own, especially benzodiazepines, antidepressants, and steroids. Any change should be a gradual, supervised process planned with your doctor. Fifth, ask about non-drug alternatives where they exist. Physical therapy for pain and muscle tension, cognitive behavioral therapy for sleep and anxiety, and pelvic floor therapy for bladder control are all evidence-based options that carry no cognitive risk at all. And finally, involve family in the conversation when possible. So many of the patients I've mentioned today were only connected to the real cause because a son, daughter, or spouse noticed a change and asked the right question at the right appointment. If you found this practical breakdown helpful, this is a great video to share directly with a family member managing a parent's medications. And of course, a like and subscribe helps this channel keep making videos like this one. Here's what I want you to remember above everything else from today. Memory changes in older adults are not automatically dementia, and medications are one of the most overlooked, most reversible causes worth ruling out first. This isn't about fear, it's about asking good questions, staying involved in your own care or the care of someone you love, and understanding that a foggy memory sometimes has a much simpler explanation than anyone initially assumes. None of this means stopping medications on your own. It means becoming an informed, engaged partner in your health care, which is one of the most powerful things you can do for your independence as you age. I know that watching a video like this can bring up real worry about yourself or about a parent you love. If any part of you recognize something in today's stories, I want you to know that noticing it and asking questions about it is one of the most caring and proactive things you can do. It's not about losing confidence in your care. It's about staying an active, informed part of it so you can keep showing up fully for the conversations, the family dinners, and the moments that matter most. So many of the families I work with tell me the hardest part isn't the medical details. It's not knowing what questions to even ask or feeling like bringing up a concern might seem dismissive of their doctor's expertise. It isn't. Every clinician I know genuinely welcomes an engaged, curious patient or family member because it makes for better, safer care on both sides. You are allowed to ask, could this be from a medication? You are allowed to request a full review. That question alone has changed the course of care for more patients than I can count. If this video helped you or made you think of someone you love, please take a moment to like it, subscribe to the channel, and share it with a family member who manages medications for themselves or a parent. In the comments, I'd love to know, did any of these 9 surprise you? I read every comment and I do my best to respond. Thank you for spending this time with me today. Take care of yourself, take care of each other, and I'll see you in the next video.